Welcome to All in All. Okay, let's dive deep into a fascinating journey today, one that really shows how building a strong foundation in one role can be the perfect launchpad for the next. This deep dive is designed specifically for you, whether you're maybe a dialysis technician thinking about becoming a registered nurse, or perhaps you're already an RN in dialysis and you're curious about the depth of skill your tech colleagues bring. We've gathered insights from, well, a range of materials, articles, training info to really unpack this path from technician to nurse in the dialysis clinic setting. Our mission is to pull out the key nuggets, showing how the specific skills, the training, and yes, the certification you get as a technician are really invaluable prep for that RN role.
Absolutely. What's really striking when you look at it is how that hands-on frontline experience as a tech directly builds the fundamental skills and the critical thinking you need for nursing. It's not just like a separate job. It really feeds directly into understanding dialysis care from the ground up.
That's a great way to think about it.
Yeah.
So, okay, let's start right there. What does a dialysis tech actually do day to day? The core function seems to be administering the dialysis treatment itself, but crucially, under supervision, right?
Exactly. Always under the guidance of an RN or a physician. But even under supervision, their responsibilities are absolutely vital for patient safety and just making sure the treatment works effectively. This includes things like meticulously putting together and testing the dialysis machines. These are complex pieces of equipment.
Got to make sure they work perfectly before connecting a patient.
Right. And then there's maintaining that sterile environment. You're working directly with the patient's access, so aseptic technique isn't just, a nice to have. It's essential.
Couldn't be more critical.
Absolutely vital.
Yeah.
And during the treatment itself, the tech is often the primary observer. They're constantly monitoring the patient, looking for any subtle changes, any signs of potential problems or emergencies. They're trained to spot issues and make immediate protocol-based adjustments, always checking with the nurse, of course, to keep things safe.
And it's not just technical, is it? There's a big communication piece, too.
Huge. Technicians are relaying real-time patient status updates to the nurses, to the doctors. They're explaining the basics of the dialysis process to patients, helping them understand simple health concepts tied to their treatment. They even write up detailed reports on how the session went.
Okay, so communicating up and also educating the patient to some extent. And they're hands-on from the start.
Yes, preparing the patient, which can include administering local anesthetic like lidocaine before they cannulate, before inserting the needles.
Right. Now, how does that stack up against the dialysis nurse role? They work together, but the roles are distinct.
They are distinct. The nurse really has the broader clinical oversight. They're often managing several patients at once, supervising the technicians, and doing those comprehensive patient assessments before, during, and after treatment. And a key difference: the nurse is educating patients on the deeper stuff, their kidney disease itself, complex treatment plans, managing all the other health issues that come along with it. They really hold the ultimate clinical responsibility for that patient during the shift.
Okay, that makes sense. Tech focuses deeply on the procedure and immediate monitoring. Nurse manages the whole clinical picture and the team. So how does someone become a tech? What's the pathway?
Well, there are generally a couple of main routes. You can do a formal training program, maybe at a college or a dedicated school, or sometimes through the dialysis providers themselves. Or actually, many people get trained right on the job. Large national providers often have pretty comprehensive internal training programs.
I saw mentions of those. They sound quite structured. What's the typical length of requirement?
Programs differ, but something around 160 total hours seems common. They often try to offer flexible schedules, maybe weekdays or weekends. Usually you need at least a high school diploma or a GED, a valid ID, pass a background check. Pretty standard stuff to get in.
And then once you're hired, getting certified, that's not really optional, is it? There's a regulatory push there.
Definitely not optional.
Yeah.
That's a key point, the CMS mandate. Since 2008, technicians providing direct patient care must get certified within 18 months of starting. It's a quality standard, non-negotiable.
Got it. And the main certifications seem to be the CCHT from NNCC and the CCHT from Bonnet. Let's dig into that CCHT exam a bit, because I think that tells us a lot about the foundation this role provides.
I agree completely. If you look at the CCHT exam blueprint, it's fascinating. They aren't just testing if you can memorize facts. Sure, there's recall, remembering things, and comprehension, understanding them. But the vast majority, like 73 to 77%, is focused on application.
Yeah, that much. Over 3/4. What does allocation actually mean in this context? How do they test that?
It means you have to take the knowledge, the facts, the concepts you've learned, and actually use them in new clinical scenarios. It demands critical thinking. You're not just reciting a definition. You're using that knowledge to figure out a problem, make a judgment call within your scope, obviously, or predict what might happen based on patient data.
So less, what is this? And more, okay, this is happening. What does it mean? And what should I do now? That really shows the active thinking involved.
Precisely. And the exam topics reflect that breadth. Clinical is the biggest chunk, 50–54% stuff like access care, cannulation, monitoring. Then technical, 18–22%, that's machine, water treatment, troubleshooting alarms. Environment, 8–12%, covering infection control, safety. And role responsibilities, 16–20%, which is about teamwork, communication, patient rights, confidentiality.
Thinking about that huge application focus, it feels like the certification itself is kind of training techs to be problem solvers, not just task doers. That seems like a really important piece for anyone thinking about nursing later. How do you even prepare for an exam that's so focused on applying knowledge?
Good question. The sources strongly recommend starting with the blueprint itself, really understanding what's covered and how. Practice questions and tests are crucial for getting used to applying what you know. And they emphasize using solid reference texts like the core curriculum for the dialysis technician, or maybe Callenbach's review for that deep understanding.
So no shortcuts, really. You need the foundational knowledge.
Exactly. Attending review courses can help, study groups are good, and maybe most importantly, just spending time with experienced colleagues, asking questions, talking through scenarios. They specifically warn against relying only on those quick prep websites because, like we said, this exam tests real application, not just test tricks.
Right, makes total sense. It's about genuine clinical understanding and the practical side, applying for the exam, scheduling it.
It's pretty straightforward. There's an application paper or sometimes online, fees involved, of course. Once you're approved, you get a 90-day window to schedule your test at a testing center. You can usually get an extension if needed. And if you don't pass the first time, you can retest after applying again. There's also an advanced cert, the CCHTA, for really experienced techs, like 5+ years, 5,000 hours.
Okay, so you've got this detailed training, this rigorous certification emphasizing application, and the day-to-day supervised practice. How does all that specifically pave the way for becoming a dialysis RN?
This is where it all clicks together, you know. The sources consistently describe the tech role as a great opportunity to explore the nursing field and gain invaluable experience and skills. The tasks techs perform, even though delegated, are the absolute building blocks for nursing practice and dialysis.
Okay, give me some concrete examples. Which tech tasks directly map onto RN skills?
All right, think about it. As a tech, you're rinsing and priming the dialyzer, setting up all the monitors and alarms. That gives you this deep, intimate familiarity with the life support gear the nurse ultimately manages. You're helping collect patient data weight, vitals, observations. That's the foundation for doing a complete nursing assessment.
Right. And inspecting the access site, reporting what you see to the nurse that's developing hands-on assessment skills, and practicing that critical communication loop.
Exactly. Cannulating peripheral access sites. That's a core invasive skill you master. Drawing blood samples, another routine clinical procedure techs become really proficient at. Plus, you're administering certain meds in a very controlled context. Lidocaine for numbing, maybe heparin in the prime, or saline flushes. It's basic exposure to medication administration and watching for patient response.
You're also constantly tracking treatment parameters, maybe making small adjustments based on protocols or nurse direction. That teaches you so much about how individual patients respond to the therapy.
Yes, and initiating emergency stuff like CPR if needed. That preparedness is vital for both roles. You're also starting and ending the treatment, achieving hemostasis, getting bleeding to stop safely. You get comfortable with these critical points in the procedure.
And I imagine just being in that environment, seeing the flow, hearing the discussions.
Absolutely. Now, if we contrast that with what techs typically don't do, it really clarifies the RN's expanded scope. Techs usually aren't assigned the most critically ill or unstable patients. They generally don't manage central venous catheters without extra specific training and sign-off. They don't administer most medications, especially IV pushes or blood products. And a big one, they don't take verbal or phone orders from doctors. That's purely an RN function.
Okay, so the tech becomes an expert in the procedure, the equipment, and the immediate patient monitoring within clear protocols. The RN takes that foundation and adds the broader assessment, complex decision-making, medication management, and overall clinical responsibility.
That's a perfect summary. And remember that CCHT exam focus on application. It's literally training your brain to think clinically, to connect the dots. It's why recognizing, say, the signs of hypotension, dizziness, feeling faint, seeing the BP drop, and knowing the immediate response, like getting the patient to sit or using Trendelenburg, isn't just memorizing. It's applying physiology knowledge instantly.
Or hearing no brute, that whooshing sound over an access, and knowing, uh-oh, this might be clotting, I need the nurse now.
Exactly. Or understanding why meticulous charting is so vital, that old saying, if it wasn't charted, it wasn't done. Troubleshooting a conductivity alarm, knowing it could be the concentrate running low, assessing dry weight, properly understanding it's the patient's target weight without extra fluid. Key for avoiding problems.
Even basic things like using proper body mechanics to avoid getting hurt, or knowing your limits and when to escalate a patient's question to the nurse. These are all applied knowledge and judgment calls, essential for safe nursing practice.
So when someone makes that jump to becoming a dialysis RN, and yes, you absolutely still need the nursing degree, pass the NCLEX, get your state license having been a tech, is just this huge head start.
Yeah, you're not walking in totally green. You already know the machines inside out, you understand the unit's workflow, you've seen common patient issues up close, and you already know how to function as part of that specific team.
And importantly, you've likely already experienced some of the emotional side of nephrology care, building those strong bonds with patients who come in multiple times a week, but also, unfortunately, dealing with the reality of patient decline or loss. That's tough, and having some exposure as a tech can provide a degree of emotional preparedness.
You also probably have a good grasp of what good practice looks like. Patient education, shared decision-making things, techs contribute to alongside nurses. You're already steeped in that culture.
It just makes the transition so much smoother. You can focus your learning energy on mastering the advanced assessment skills, the broader medication knowledge, the complex care planning, because you're not simultaneously trying to figure out how the dialysis machine works or where supplies are kept.
So yeah, what this deep dive really hammers home is that being a dialysis tech isn't just a job you do before nursing school, it's practically foundational training. It gives you solid hands-on skills, forces you to practice critical thinking through certification, and provides just invaluable direct experience with this unique patient population and the whole care team.
Exactly. Building that specific clinical and technical knowledge as a tech really equips you with a unique perspective and skill set. It makes pursuing the RN role in dialysis a really powerful, logical next move. You bring an understanding that nurses new to dialysis just won't have initially.
It really underscores how both roles, tech and nurse, are so crucial and contribute differently but equally, you could argue, to the patient's care and safety. There's immense trust involved in both.
Yeah, trust in the tech to run the procedure safely, monitor closely, trust in the nurse to see the bigger picture, manage the complexities, and that tech experience definitely enriches your ability to be an effective dialysis nurse.
Yeah.
Here's something to maybe chew on. Given how much the tech role emphasizes applying knowledge and troubleshooting within set protocols, think about how moving to the RN role expands that critical thinking even further. Now you're not just troubleshooting the machine or the access, you're troubleshooting the whole person connected to it, how dialysis affects their heart, their fluid balance, their electrolytes, their overall condition. It requires an even more complex level of problem solving and clinical judgment. It's a fascinating progression.
Thanks for listening to All in All.